do. We have another speaker lined up that is going to give us an exciting talk about conservative management, and that's Jen McLeod. Please come on stage. Yes, perfect. So I have a couple of, I called a couple of people about Jen, and I heard that she did an internship at University of Georgia.
Yes.
I did too.
Oh, I didn't know.
Isn't that amazing?
It's a great place.
Great. And then she did a residency at Penn, and she is another person that's hopping from private practice to academia to private practice, so it seems to be the trend here. And she told me that she thinks, and I'm just going to summarize her talk so we can go to lunch early, that multimodal therapy is the best. So thank you very much and goodbye. But really the main thing, the most important thing was that her husband is a vet. And then I wanted to ask all sorts of questions and she ran away. So I don't know what that means exactly, but her husband is a vet and she's an amazing speaker. So a big hand of applause for Jen.
Thank you. Thank you very much, and I thank everyone for being inside on such a beautiful day. He was asking me for some personal information. I wasn't sure what he was going to do with that, and since he didn't give me the pregnant pause, I didn't really give up too much. So what information he got was from Heather. But thank you, Heather. But I want to thank Hills for inviting all of us here and for me to speak on what I think is probably one of the most important topics in canine health, and that's osteoarthritis and what can we do about it. This slide here is just kind of to remind me that the take-home point of my talk. So these are two of my dogs, my young three-legged shepherd puppy and my older shepherd. And just that osteoarthritis management starts early and it will be lifelong and it will change throughout the lifetime. As we have heard a lot of information from the last speakers, I was excited to see that a lot of the things that I'm going to say have already been said, and so that means that we're kind of in agreement about a lot of things, but the biggest things we can do are to start early and to keep going. Some reports say anywhere from 20 to 60% of dogs are affected with osteoarthritis in their appendicular skeletons, and so anything that we can do to understand this disease and hopefully treat it the earlier we can do that, the more benefit we'll have for our patients. So first we have to start with what is osteoarthritis and talk a little bit about the pathogenesis, so again we can kind of understand the disease and hopefully get to the basis of treating it. But osteoarthritis is a slowly progressive degenerative disease. It's really characterized by articular damage, and also we have new bone proliferation at the margins, which is osteophytosis, and then we're going to see synovial membrane thickening and fibrosis. It's important to realize that osteoarthritis is a global disease entity. It affects every tissue and structure within the joint. So again, we're going to see a thickening and fibrosis of our synovial membrane. We're going to see fibrillation and damage to our cartilage. And we're going to see an increase in synovial fluid as well as a change in the cellular component of that fluid. The main focus of osteoarthritis is obviously the articular cartilage. Hyaline cartilage is a very wonderful structure that, once it's damaged, cannot be repaired. The components of the articular cartilage, of course, are the chondrocytes, which are the cells that make the extracellular matrix. The extracellular matrix, which is composed of our type 2 collagen fibers, and then these wonderful proteoglycan molecules. And proteoglycan molecules are this long protein core that is having these glucosaminoglycans, or GAG molecules, hanging off of them like brush bristles. And it's this structure of the proteoglycan molecule that allows it to trap water. And water makes up the third part of cartilage, and it makes up the most part of it, about 70%. But it's really this proteoglycan molecule that allows that water to be trapped in there, and then it also allows the cartilage to absorb and release that water with increasing load, and it allows the joint, the bone ends, to glide over one another with very little friction. So the chondrocytes, again, are the cells, the workhorse. Here they're making the components of the extracellular matrix, but they're also responsible for making the enzymes that degrade the matrix. And osteoarthritis occurs when this catabolic process outweighs the metabolic processes that are going on. And this is a histologic section from healthy cartilage showing nice chondrocytes and a nice evenly staining pink or purple background of the extracellular matrix. Osteoarthritis occurs in 3 overlapping stages. In the first stage, there really is the extracellular matrix is starting to degrade. During the second stage, those chondrocytes are starting to compensate, but during the third stage, they lose the ability to do so. And what happens over time is you see a loss in this proteoglycan structure and amount, and that leads to an overall inability to retain as much water. And with the inability to retain water, the cartilage becomes less compressible and less strong, and we start to see this fibrillation. So here is histologic structure of normal cartilage, again showing those arrangements, nice even arrangement of cells and the nice staining background, versus a cartilage from an osteoarthritic joint, which is showing this fibrillation and damage to the cartilage. And again, once this cartilage is damaged, nothing can be done to repair it. Cartilage itself has no nerve supply and it has no blood supply, so it receives its nutrients really from diffusion, and that's one of the reasons why it's very difficult to heal once there's been damage. And so when we have this cartilage damage, we'll start to see erosion and ulceration of the joint surface. And this is showing, this ridge here has a nice white gleaming cartilage, and then we start to see these full thickness erosions lost at the surface with arthritis. Osteoarthritis can either be primary or secondary. Primary arthritis is usually due to overwear or overuse of the joint, and this is what's typically seen more in human athletes. But it can also be secondary, and when it's secondary, it's usually related to an underlying developmental or acquired joint abnormality that leads to an instability or incongruity of the joint. And secondary arthritis is much more common in our canine patients. Secondary arthritis, most commonly associated with laxity, and this here is showing just a young dog, radiographs of the coxofemoral joint with this laxity, and this same dog several years later with the classic signs of hip arthritis. We know that hip laxity and joint laxity will lead to the development of osteoarthritis. Ligamentous instability, probably the most common thing we see there is cranial cruciate ligament rupture, osteochondrosis or OCD lesions that lead to cartilage flaps and promote inflammation, and then certainly trauma, which I think we see as well. And all of these predispositions lead to osteoarthritis, and that leads to the clinical signs associated with osteoarthritis, which are joint pain, decreased range of motion, joint effusion, and all of that leading to lameness and immobility. So when I think about the goals of effectively managing osteoarthritis, we obviously want to decrease pain and therefore decrease clinical signs. Anything that we can do to also slow the progression of osteoarthritis is going to be helpful, and promoting any kind of repair of degenerative tissues if we can figure out how to do that, and overall just increase comfort and mobility and get our dogs back to activity. Just like everybody's been saying, I think early identification of these patients is extremely important. Anything that we can institute earlier is going to be far more effective than anything we can do later on once the cartilage is already damaged. Once that damage is there, it's really impossible to reverse it, so anything we can do early is really important. And these patients are often difficult to identify early. Sometimes their signs are intermittent, sometimes they're nonspecific, and we really need to pay attention to owners. We do want to make sure that if an owner comes in and they have a concern about something going on, that we're going to pay attention to that and make sure that we look further into it. So part of the way that we can help diagnose this early is by a careful physical examination, making sure that we're paying attention to joint laxity, joint pain, joint effusion. We had a question earlier about physical exam and how can we do better at that. Making sure that we're taking those joints through range of motion and realizing that sometimes the pain is really at the end of that range of motion or the extreme of it, rather than just putting a dog through a mild range of motion, making sure we're really flexing and extending those joints to see if they're painful. We're also going to use radiographs. Radiology is an important way of diagnosing osteoarthritis. And we're going to take radiographs most often based on clinical signs. So what is the main concern that an owner or a dog is showing? But sometimes it's going to be based on a breed predilection for a certain problem or a family history of that problem. And this radiograph here shows a lucent line here at the synovial membrane attachment, Morgan's line, which can be associated with an early sign of arthritis. arthritis. And this is also to point out that we also don't want to overdiagnose. We don't want to treat a dog based on its x-ray, but it is a starting point to talk to an owner about the potential that their dog could be predisposed to developing arthritis, and what can we do early on to prevent those signs from affecting the dog's life later on. So, I just keep talking about owner education, but really it's making sure that owners know what to look for and also what to expect as their dog gets older. Management plans may be really simple as at a first diagnosis, when we're first making the diagnosis of osteoarthritis, and then that plan will change over time and with complexity of the disease. It is a lifelong task, and it doesn't, the other thing is that we want to make sure it's not too daunting for the owner. We don't want osteoarthritis to be a death sentence. We want to make sure that owners just know that this is something that we have and something that we'll be looking for and knowing what to expect. A management plan, again, at first it may be simple. It may just constitute, making sure that we're talking to owners about weight before dogs are heavy. So making sure that they're focusing on lean body weight, body condition score, that we're telling them about diets. Hill's JD diet has been a wonderful implementation in my practice. I think it is a really good tool, but making sure dogs are on a good diet, making sure they're having the proper supplements, things that can help them as they age. And then making sure that dogs are on an exercise plan, making sure they're getting good, consistent, controlled activity, and that is a lifelong process for them, as well as the owners. And that, again, this plan may change as the dog gets older and disease changes. I'd be remiss if I didn't mention surgery, as I am a surgeon, but I was told I wasn't allowed to talk about surgery. But since we know that arthritis in dogs is generally secondary to an underlying condition, if we can identify the underlying condition and fix it early, we can sometimes help decrease the inflammation and decrease some of that progression of arthritis. It's important to know this is a sagittal section through a canine shoulder. And it showed up upside down, I'm sorry. This is the scapula, and this is the humeral head, and this is an OCD lesion of the humeral head upside down. But this is, OCD lesions. If we can get in there early, we can help decrease inflammation, get these dogs back to activity and to function earlier. And earlier is going to be better. But owners do have to be counseled that even though taking this inciting cause is necessary to get back to joint function, we still may have the development of arthritis. So again, counseling them that as the dog ages, we may be looking for signs of recurrence or of arthritis as the dog gets older and need to treat or change the management plan accordingly. When I think of, what do we have as the goals? So again, we're trying to avoid pain if we can, obviously, alleviate pain if we have it. We want to maintain strength and fitness, and we want to maintain joint range of motion. And so when I think of the goals of that in the management of osteoarthritis, I always think of these 5 tenets. I think of weight optimization, nutritional supplementation, as well as getting them on a good diet, the exercise modification, physical therapy, and then medications as owners, as dogs get older or progress with their disease. So weight optimization, I think, is the most important thing, and we just heard a whole talk on that, and some of the things that I'm going to say are the same things that we just heard, but I can't stress how important weight is in our patients, and I think we all know that, and I think it's really important to have that discussion with an owner. There has been some evidence about avoiding rapid growth in the first year. There was a study in the Journal of Nutrition in Great Dane dogs, and they showed that those dogs that were allowed to grow rapidly in the first year with over-nutrition supplementation, their bones were larger, but they were more brittle, and when you coupled that with the increased weight and muscle mass, there was a lot of load on those bones, and they had a more predisposition to having OCD and other developmental disorders. So making sure that we're watching their growth during the first year is really important. Osteoarthritis progresses more rapidly in obese animals, and we just heard about that. Certainly there is also some suggestion that, and we heard about this earlier too, that when dogs are obese, there may be more inflammatory mediators like IL-6, tumor necrosis factor, that are going to increase the development of that arthritis. And also, when dogs have arthritis and they're overweight, they have a less tendency to do things, and so if their calories aren't restricted during that period, they can even gain more weight. And that we have clinical signs that can decrease if we lose weight. So certainly the less weight you have to get up and get around, the better you're going to be able to do so. So even if a dog is overweight, the best thing we can do is to avoid them being overweight, but if they are overweight, having them lose weight is important. And we've already seen the body condition score, and I also show this to owners every chance I can get. But it's making sure that owners understand what body condition score is. And I always hesitate to say, because owners always ask me, how much should my dog weigh? And I'm always hesitant to give them a number of what their dog should weigh or how many pounds their dog should lose. But I try and have them focus on what the dog looks like, the nice hourglass figure from up above, and a nice abdominal tuck from the side, and making sure that they realize, just like the Keeley study and the Purina study showed, dogs that are thinner live 15% longer, and they had the same chronic conditions, but they were treated for them some 2 or 3 years later than that. So it's so important in the quality of life of our patients. And then not only how much to feed them, but also what to feed them. And I already mentioned the Hills JD diet, which I do promote, not just because I'm here at Hills, but because I think it's a really good product. Diets rich in omega-3 fatty acids have been shown to help dogs get up and move better when they have arthritis. And how that works, and I'm sure we're going to hear more about that, but arachidonic acid is taken from the cells during tissue damage, and the breakdown of that arachidonic acid is the inflammatory cascade. These omega-3 fatty acids are actually broken down by those same enzymes and so compete for it, but they release fewer of those inflammatory mediators. And so with this increase in omega-3 fatty acids, we can see fewer of those inflammatory cells and hopefully have dogs be getting up and walking around better. Glucosamine and chondroitin, I use them a lot. A lot of the research is kind of up and down about them, but I think there's more and more research to support their use. Glucosamine is a building block for the GAGs, the glucosaminoglycans that are holding that water into the proteoglycan molecule in the chondrocyte. In the cartilage, and then chondroitin, which helps it hold water, and both of these are thought to have anti-inflammatory properties aside from their structural properties. And then, if I can say this word right, avocado soybean unsaponifiables. They are, thank you. They are products that are made from the oils of soybean and avocado. They have plant phytosterols in them that are known to be antioxidant and anti-inflammatory, and they're also thought to have maybe some anabolic properties as well. And exercise modification, it's very important in the management of osteoarthritis. And a lot of times when I'm first seeing an animal that's presenting to me, they're in a very inflammatory phase. And so generally my exercise modification or plan is going to start with a period of exercise restriction. We're going to try and get them both medically and exercise-wise under control so that they have less inflammation going on at the time. And then we're going to gradually increase that activity over time in a low-impact way, back gradually. And I think this is important, just with a weight loss plan, that the exercise plan is something where you can't just say, go gradually introduce your dog back to activity. It's something where that plan really needs to be outlined with them. And I have them reevaluated every 2 to 4 weeks along the way so that we can kind of make sure that this plan is going. And I also think it's important to engage the owner with this. So it's giving them something to do that they feel personally responsible for. And if they can see that it's improving their pet and they feel good about it, they're more likely to stick with this. This study here, Dr. Little's study, where he looked at the Labrador retrievers with hip osteoarthritis, they showed that dogs that exercised more could exercise more, and that increased with the time that they were increasing. So exercise may, in fact, promote pain relief, but it also helps them, feel better. And physical therapy can help not just only in the adding to weight loss programs, but it helps maintain a joint range of motion, muscle strengthening, and it helps with an overall well-being. Lots of physical therapy centers popping up everywhere. Probably some of your clinics even have physical therapy available. My clinic, unfortunately, doesn't, but I think it's a great part. If owners can swing it both with finances and with time, I think getting them on an actual physical therapy plan is really good. And most of the physical therapy centers that we work with in our area will do visits with owners and give owners plans and exercises to do at home, which I think is really great. And then, medications come into play. It may be that we're going to use medications intermittently at first, as the disease is kind of progressing, but maybe not as far progressed. And then maybe we're going to need to use those medications more consistently as the dog's condition warrants that. Certainly there are other medications and other things that we're going to talk about, and we're going to tailor a program to each individual patient. So as osteoarthritis really progresses, we're going to talk about pain management. I mean, that's mostly what we're dealing with is chronic pain management. Wasava has a website, and they have a website that published ways to recognize pain in animals. They have guidelines, and it's really very encompassing and something that you can all pull up online. But looking for signs of pain, and we talked about that too. You have owners who come in, their dog's not putting their leg down, but they don't think the dog is painful. We're going to be looking at, for ourselves, the mobility, activity, overt signs of pain, and also affect. Is the dog not eating? Is it hiding? Those things that we typically think of. Maybe the dog is uncomfortable. We know that potentially, but maybe the owners don't. So it's really counseling owners that, we're going to do a physical exam and we're going to try and determine if the animal's painful, but we also want the owners at home to have the same information so that they can decide, is the animal showing different signs at home. And since osteoarthritis is a global disease, a multimodal treatment protocol is going to be necessary. No single agent is available to cure or treat this disease, and we're going to use a combination of anti-inflammatories, pain medications, weight loss, exercise, and we're going to tailor a plan, and it really needs to be tailored to each individual patient. So nonsteroidal anti-inflammatories are really the mainstay of pain medication for osteoarthritis. They are anti-inflammatory, they're analgesic, they are extremely effective, and there's lots of evidence to support that they are extremely effective at controlling the pain associated with osteoarthritis. So as I talked about before, this is the arachidonic acid pathway. So with tissue injury, we are going to have arachidonic acid that is released, and that arachidonic acid is metabolized into inflammatory mediators. And a nonsteroidal anti-inflammatory drug is any drug that inhibits one or more step in this pathway. The cyclooxygenase enzymes are the ones that are most targeted. Our COX-1 enzyme is thought to be constitutive, and that's supposed to be for housekeeping functions like renal protection, gastroprotection, blood clotting. And then we have our COX-2 enzyme that is what we think responsible for all of the inflammation going on with osteoarthritis. And so most drugs are trying to target our COX-2 enzyme, sparing our COX-1 so that we have fewer side effects. Of course, there's lots of drugs out there, Rimadyl, carprofen, all of the ones that you guys all use, and we're trying to get better at COX-2 selectivity, but the dose of the drug and the drug itself all vary in that respect. So when we give the anti-inflammatory, I think is very important. Joint osteoarthritis is a cycle. We have joint pain, and that leads to disuse, and that leads to musculoskeletal deterioration, which leads to less joint support, which leads to more pain. And so when we can give this anti-inflammatory drug and break this cycle, hopefully we have less damage from that inflammatory cycle going on. Nonsteroidal anti-inflammatories work in the periphery. So they inhibit the prostaglandins here peripherally, and they give good pain relief. It leads to more joint motion and better physical ability to use the joint. But most people think that the peripheral effects aren't the whole story. NSAIDs seem to be so effective that people do think that there is a central action of the NSAIDs as well. And it's hard to study this because it's hard to separate the peripheral from the central effects. But it's been proposed that maybe there is a central inhibition of prostaglandins, or maybe the NSAIDs are actually working at a central opioid receptor, or they're inhibiting serotonin reuptake. But it does seem that NSAIDs are so effective, there's probably more than one mechanism of action going on. So NSAIDs are really easy to use. They're very widely available, and they offer effective and predictable pain control. This study here from Veterinary Record actually showed that the longer that you use nonsteroidal anti-inflammatories, maybe even the bigger the benefit that may be. And they didn't show any increase in the number of side effects over the increased length of use. So I think that's a really important study, and knowing that a lot of times we're using NSAIDs for maybe 2 or 4 weeks. We're hesitant to maybe take them out longer than that, but it may be beneficial in those dogs. You're trying to manage them through a cruciate ligament rupture without surgery. We know that's going to take several months, maybe even having them on NSAIDs longer, we're going to get a bigger benefit from that. Of course, side effects do occur with use of nonsteroidal anti-inflammatory drugs, and those side effects are generally related to the GI tract. This is a picture I took intraoperatively of a dog that had a perforated pyloric ulcer from the use of NSAIDs. So although rare, side effects do occur. When they occur, they can be severe. And the interesting thing about this patient was that the only sign that she presented with was inappetence. So you want to really make sure that you pay attention to subtle signs that may be a bigger problem. So how can we minimize the risks associated with nonsteroidal anti-inflammatory use? First thing is going to be patient selection. So we're going to want to make sure that our patients are good patients for these drugs. We're going to want to know what other drugs they're on. So maybe they're on topical medications that have steroids or nonsteroidal anti-inflammatory drugs in them. So we want to make sure we're aware of those things. And then dose selection, treating this patient based on its lean weight rather than on its heavy weight. So most dogs are overweight. We don't want to treat this 50-pound dog in a 100-pound dog's body as a 100-pound dog, because that's going to be giving them too much. And then monitoring, again, both by physical exam and then owner education. The owners need to know what to look for, dark tarry stool, vomiting, inappetence, things like that that may indicate a bigger problem. So when we use nonsteroidal anti-inflammatories, most of the side effects are seen early. So again, there's not been a study that showed that an increased length of use was associated with an increased number of side effects. So generally, we're going to see the side effects within the first 2 to 4 weeks. And we're going to make sure that we're monitoring. So signs at home, physical exam, and then we're also going to be doing routine blood work. So when I have an animal that's on nonsteroidal anti-inflammatories for a long period of time, I'm making sure that I'm looking at serial blood work and looking at the liver values, the kidney values, and looking for trends in those things to be rising. So what do we do when nonsteroidal therapies don't work, or when we can't use them? And there are other alternative therapies as well as other drugs that I'm going to go through. So Adequan is one that I don't know how many people are using Adequan, but it is a polysulfonated glucose aminoglycan. When given intramuscularly, it's been shown to infiltrate into the cartilage bed, and it maintains a more normal joint histology by having the chondrocytes make more of the cells that hold the water. So it actually becomes more resistant and more resistant to degradation. The problem is that we need the chondrocytes to make the GAG molecules and the proteoglycans, and so we are often using this, I think, a little bit too late. So I tend to use this once everything else is failing, dogs are painful, NSAIDs aren't working, oh, let's try Adequan. Well, if there's not enough chondrocytes there and the cartilage damage is already there, it may not work as well. And so maybe instituting this earlier into our protocol may be better. I've already talked a little bit about, glucosamine and chondroitin, and there's also MSM or methylsulfonyl. The word just went out of my mouth. All right, MSM. And so this is a naturally occurring sulfur compound. Sulfur is used to link the GAG molecules in the proteoglycan, and so it's hopefully helping to increase the strength and the resilience of cartilage. With the nutraceuticals, I think it's really important to know, that these are not fast-acting compounds. So these are things that we can add, but they may take, 6 to 8 weeks before we're going to see any benefit. So we have to be aware that that's not going to be a quick fix. As far as other medications, tramadol is one that's very widely available. This is a synthetic opioid medication. It has a weak affinity for the mu receptor, and its exact mode of action isn't really clearly understood. Some of the newer studies that are out there are really questioning the efficacy of tramadol, especially in dogs. It is really written down for it to be a 2 to 4 microgram per kilogram dosage. I tend to think that it really doesn't work at that low a dose, and I generally dose them more like 3 to 5, and especially if I'm using this as an only drug, I think it's, it does need to be dosed a bit higher. Gabapentin was an anti-seizure drug that was originally used to treat epilepsy, and people found that it had pain-relieving qualities for chronic or long-term pain, neuropathic pain. And I think that this drug really does help our patients. I think it's extremely helpful if you can use it along with an anti-inflammatory, but I have seen this really help in dogs that are failing when only being treated with a non-steroidal. And amantadine is another agent. It was an antiviral, or it is an antiviral agent, and it was found to inhibit the NMDA receptor. And the NMDA receptor is associated with that sensation of chronic pain. Dr. LaSalle actually did a study where he looked at dogs that were being treated for osteoarthritis with an NSAID, and then he added in amantadine, and those dogs did better. And so that was kind of a good study to show that, the first kind of multimodal treatment drug therapy study that showed that the addition of this drug really did help. Durolactin is another one that I've just started hearing about this and using it, but it's a dried milk protein from hyperimmunized cows, and it actually blocks the cytokines that recruit neutrophils to the inflammatory process, and so hopefully decreases inflammation and then decreases the tissue damage that is associated with that. Because it acts at the cellular level, it doesn't inhibit prostaglandins, so it doesn't have any of the GI side effects reported that NSAIDs have. And I have used this in patients that can't be given NSAIDs, and anecdotally I've had some owners tell me that they think it really does help. Looking at alternative therapies, acupuncture is something that's been used for a whole host of maladies in people. And in people, they've found that people with knee arthritis did better with acupuncture if they'd been treated with other modalities. So again, not necessarily as a sole treatment, but along with anti-inflammatories, I think acupuncture can really be helpful. Laser therapy is another therapy that's becoming more and more widely available. How many people have lasers in their practice? Yeah, so a good number. And laser therapy, it can work, I think, in kind of two ways. One way is it has some bioenergetic effects where I think you're putting some pressure on some of these acupressure points. And then it also can have thermal attributes where it's actually stimulating tissue warming and damage. And again, this is something where I have a lot of anecdotal evidence that people think it really helps and really decreases inflammation and gets dogs to feel better, but there's not a lot of papers and research out there, and it's something I think we need to look a lot more at. And then this is a really exciting area of research here, stem cell therapy and platelet-rich plasma. And what this is taking a patient's own fat or blood, and what we're doing is trying to get the potential stem cells and cytokines. We inject them back into the animal where locally they act as anti-inflammatories, but they also act as the building blocks to hopefully restore and repair damaged tissue. Again, this is kind of a much newer therapy, but a really exciting area of research, and I hope a lot more of this is going to come out. And then I have to go back to surgery. But when we're failing medical therapy, sometimes there are surgeries that are available that can help. So excision arthroplasty or femoral head and neck ostectomy, sometimes fusing of the joint, arthrodesis, and then joint replacement. So this is a total hip. Oh, I'm doing that back there, no one can see it. Total hip replacement, but knee and elbow replacements are also becoming more and more available and studied. So, sometimes joint surgery is available to help animals feel better and get back to function, especially if they're failing medical therapy. I just wanted to, I have a couple of cases just to kind of go through, and I don't have time for all of them. I'm sorry. I actually thought I could get through 80 slides, but I don't think I can. So we're going to go back here. All right, so I'm going to start with this. So I just want to do a couple cases to look at how do we treat patients and what does it look like to have kind of a multimodal treatment plan, and how does that treatment plan change kind of over life. So this is Lily. Lily is a 3-year-old female spayed Labrador Retriever. Her presenting complaint was a left hind limb lameness of several weeks duration. Her lameness was worse in the morning and after lying down. It's a pretty typical story. On physical examination, she was found to have a toe-touching lameness of her left hind limb, pain on hyperextension of the left stifle joint with joint effusion and a cranial drawer sign. Her right stifle was stable. She had no hip or back pain. So what's our diagnosis? All right. So we took a lateral radiograph of Lily's left knee, and the question that I have for you is, does Lily have osteoarthritis? Wow. Yes. Okay. Wow. Only 53 votes. Come on, guys. I'm not going to win that, sir, right? Okay. I'm going to be competing for how many votes I can get. Can we get? Yeah, there we go. All right, nice. Okay. Does this stop on its own, or do I? Okay. So here is Lily's radiographic diagnosis. So she has severe synovial joint distension. And it was read out by the radiologist as mild periarticular remodeling. So maybe there was some mild arthritis seen, maybe a little bit of irregularity here and here. Really not much in the way of radiographic arthritis, but she is set up as a nidus for having arthritis later in life, right? So I kind of agree with 88% of you who say, yes, she does, because maybe it's not evident here on this radiograph, but we certainly know that with her joint instability, that's a reason why she's going to develop arthritis later in life. So when I talked to her owner, we recommended surgery. We did do a TPLO. There is some evidence to suggest if we can stabilize this joint earlier, maybe we can prevent some of that progression and lessen the progression over time. But we're going to talk to the owner about the fact that this isn't over. She is going to do well after surgery. Maybe her lameness is going to go away after surgery. But as she gets older, this treatment plan may come back into effect, and medications may be a part of her life later in life. So my treatment plan initially is always for the first 2 weeks, getting that inflammation under control, whether that is the surgical pain as well as the inciting incident. We're going to do 2 weeks of complete restriction on her activity, and we're going to give her medications. Non-steroidal anti-inflammatory drug coupled with tramadol for postoperative pain. And we're also going to make sure that her owners are monitoring her weight. So during this time, she is being less active. She is going to need fewer calories, making sure that that is happening. And also dietary optimization. So we switched her over to the Hills JD diet, so she's getting some of those joint protective factors along with it. Her treatment plan over the following 3 months is we're going to gradually increase her activity, and we're going to gradually decrease her medications and keeping some of the other things the same. But again, outlining an exercise plan for my owners. So I generally have them start with 5-minute leash walks twice a day, increase that amount by 5 minutes every week. And again, I'm checking in with them every 2 to 4 weeks. Lily's owners were great in that they could do actual physical therapy. They went to a physical therapy center, and they were doing 20-minute physical therapy sessions twice a week, which really helped Lily, I think, improve more quickly. And at her 8-week re-exam, her bone is healed. I cut off this radiograph because there was actually a glove in here, and this wasn't taken at our clinic, so I just wanted to crop that out. But her bone was healed, and she had no lameness. She still had mild muscle atrophy of that limb, but she was doing really well. And so going forward, her treatment plan, again, is just to make sure that we're continuing with that weight optimization. And Lily was actually in excellent body condition, so making sure that I praise her owners for keeping her such and making sure that they recognize that as she gets older, she's going to need fewer calories, and making sure they keep monitoring that. And then an exercise program that, again, consists of controlled, consistent activity, keeping her joint healthy. And then monitoring for a return of lameness so we can change that treatment protocol. All right, I have 2 minutes. I have to get through this one. 14-year-old Rottweiler mix. Her presenting complaint. This is Shayna. She had difficulty rising, progressive over the past several months to years, and she wasn't on any current medications. Shayna was also heavy, 8 to 9 out of 9. She did have difficulty rising, and she had pain in multiple joints, as well as lower back pain. So I didn't put a question about whether Shayna has arthritis, but what we can see on these radiographs is that she does have signs of hip osteoarthritis. She has thickening of her femoral heads, and she has new bone formation or osteophytosis, both in her hips and her stifles. Now, she has pretty mild arthritis, I think, for especially the signs that she was showing. And so, again, her obesity was probably exacerbating that, but also not to treat the radiograph, but to treat the dog. Her signs were much more obvious than they are on these x-rays. So her diagnosis, stifle arthritis, coxofemoral arthritis, lumbosacral pain. So initially, we're going to start with weight loss, and I, too, ask owners to first quantify what they're feeding the dog. Sometimes they don't even know. Multiple people are feeding the dog. They just throw a scoop. The bowl is always full. But I ask them to take a container and actually start to quantify that, and then whatever they've quantified, decrease that by 25%. So we started there. We changed her over to a good diet, and we added in a nonsteroidal anti-inflammatory medication, again, starting with a period of exercise restriction and going forward from there. Knowing that Shayna was probably going to be on NSAIDs for long term, I did run some blood work. Can you guys see that? So the thing that's out of range here is her alkaline phosphatase. So it was about 3 times the normal range. And my question to you is, should we continue to treat her with nonsteroidal anti-inflammatory drugs? Oh, good. Yes, 93% yes. And I agree with this. You know, I don't think of liver enzyme elevation, especially if mild, as a reason not to treat with nonsteroidal anti-inflammatory drugs. But what we are going to do is to look for trends. So we definitely want to repeat that and make sure it's not something that is rising. Her blood work was then repeated in a month, very similar, so nothing that worried me extremely, and we were able to keep going with that plan. The other thing to notice is that Shayna represented just a week ago, 2 years later, having some of the same similar signs. And so, you know, we added in different medications. We added gabapentin, tramadol, and her owners are trying alternative therapies. Shayna's now 16 years old. She's not a very good surgical candidate, but and then starting to counsel the owner about supportive care and end-of-life issues also, so that we can have that discussion. Sorry, I'm out of time.
All right.
Those are my summary.
Out of time.
My summary slide.
Thank you, thank you, thank you. Excellent job. Thank you very much.
When they cut you off here, they really cut you off. You can't even read my summary slide. There
yes,
you go.
We do cut people off. We warned them, you know, and I said, 81 slides, are you insane? She said, no, I'll do it. No
I'm
problem.
from the Northeast also. I talk really fast.
And she talks a little fast, but this was an amazing talk. Thank you so much. So any questions, audience? And when you ask your question, ask it really fast. See, you kind of overpowered them. There's one. Yes, we have a runner. Good job, Omar.
What kind of dose do you use for the amantadine? Did I say that right?
Yes, amantadine, and I have to look that up. I'm sorry. I think it's, I don't want to say off the top of my head because it may be wrong. I'm going to look it up and I can get that to you. I'm sorry.
All right. There's a really cool app that you can download to look it up. All right. There's another question. Yes.
I was wondering if you have your patients on JD or JD plus, the metabolic plus mobility, do you supplement in addition to that with nutraceuticals?
I often don't. You know, I often will, because I think that that has an adequate amount in there. Sometimes if I have a dog who's on an anti-inflammatory and on JD diet and they're having an inflammatory episode, sometimes I'll have them add in an extra supplement, but generally I don't do that.
There's a request for a microphone right here.
Hi. When you have a dog that you know that if you suspend the NSAIDs, the dog is going to come back with pain, and you have to give it for life sometimes. Do you lower the frequency at some point? I mean, instead of giving it every 24 hours, to give it every 48 hours if the dog improves?
Yeah, and I often will do that as kind of a test with owners. So when I'm attempting to get a dog off of anti-inflammatories, I will sometimes have an owner give it less frequently to see if it makes a difference. I find that if I have them give it less frequent and they're seeing episodes of pain, maybe it's not time right now to do that. So yeah, I will try that as a way to test if they can be off of it.
All right. Any more questions? Do we see hands right there? Oh, there's one. Okay.
With respect to the Great Dane study you cited, are you telling owners with large breed dogs to feed a maintenance diet instead of a puppy diet at like 6 months of age? Are you in that camp? You are?
Yeah,
across the board?
I do. I mean, it depends on the breed, obviously, but I just want to make sure that those dogs aren't growing too quickly. You know, in that study, they didn't find that the dogs that were restricted in their calories ended up as smaller adults. They ended up getting to the same size. It's just the time with which they're growing. So we don't want them to grow too rapidly right away.
Okay, one more question. Last minute.
It's a very long-winded question here.
Okay, thank you very much and goodbye.
It's not really. So, I'm so often in the position where people come in and I go through this whole spiel of all these different things that I can do with the JD and the glucosamine chondroitin and the NSAIDs, and it's overwhelming, not just from the perspective of the amount of stuff, but from the cost of all these things. What do you generally start with as your, at the start of arthritis when they come in?
So if I'm seeing them during an inflammatory or painful episode, is that what you're asking? Or even when I'm seeing them early when they have maybe some hip pain or abnormalities in their gait?
Arthritis.
I mean, early on, I'm trying to keep it very simple. I try and get them on a good diet, like I said, the JD, so I don't think we need to have any of those other supplements necessarily, making sure that their weight is being appropriately managed and that their exercise is keeping them consistently active is the biggest and best thing. So those are the three things that I talk to every young dog owner that I see, because most of them are presenting for some orthopedic reason. That's what I start with. And then I add in anti-inflammatory medications or other pain medications as needed, but making sure that those three of the basic tenets are still being fulfilled.
Great. Thank you so much.
Thank you very much. And once again, thank you. Great job. Great job.